What I am about to tell you could change the way you look at those 2 blood pressure pills sitting in your weekly organizer. Because if you are over 60 and taking amlodipine and losartan together, there is something you need to understand now, not later. I'm Dr. Clara Hoffman, and this combination is prescribed every day. For many people, it works well. It lowers blood pressure. It protects blood vessels. It can be an effective treatment plan. But here is the problem. When side effects begin in older adults, they often do not feel like side effects. They feel like aging. They feel like weaker legs, poor balance, swollen ankles, afternoon exhaustion, a pounding heartbeat at night, a strange unsteadiness after standing up, a body that suddenly does not feel reliable anymore. And that is exactly why so many seniors miss the warning signs until something frightening happens. Now listen carefully, because this part matters. This is not a message to stop your medicine on your own. Never do that. If Dr. Clara Hoffman or your prescribing clinician placed you on amlodipine and losartan together, there may be a very good reason. One medicine relaxes blood vessels through one pathway. The other blocks angiotensin II, a hormone system that raises blood pressure, through another. Together, they can control pressure very effectively. But effective does not mean harmless. Not after 60. Not when kidney reserve may be lower than it used to be. Not when a hot day, poor appetite, stomach illness, or one missed glass of water can change how your body handles the exact same dose that felt fine last week. And here is what concerns me most. Many seniors do not get into trouble because they took the wrong medication. They get into trouble because they kept taking the right medication while ignoring what their body was trying to say. A little swelling becomes severe by evening. A little dizziness becomes a fall at 2 a.m. A little weakness becomes blood work that suddenly shows kidney stress or potassium that has climbed too high. By the end of this video, you will know the 7 side effects this combination can cause, why they happen, which one is the quietest but potentially the most dangerous, and what should never be brushed off as just getting older. Before I show you side effect number 7, you need to understand one thing that changes the entire story. Amlodipine and losartan usually do not create problems in one dramatic moment. They do it slowly, quietly, almost politely. Amlodipine relaxes blood vessels. That can lower pressure well, but it can also allow fluid to shift into tissues and cause swelling, flushing, or a sense that your heart is beating harder than usual. Losartan lowers pressure through a different system. It can be very useful, but it also affects fluid balance, kidney handling, and potassium regulation. Put them together, and yes, you may get good blood pressure control. But you may also create the exact kind of subtle symptoms older adults are most likely to misread. So let us begin with side effect number 7. Side effect number 7 is swelling in the ankles, feet, and lower legs. Not a little puffiness you barely notice. I mean the kind of swelling that makes your socks leave marks. The kind that makes your shoes feel tighter at dinner than they did at breakfast. The kind that makes your legs feel heavier by the end of the day. This side effect is strongly associated with amlodipine. The medicine relaxes arteries very effectively, but the return flow on the venous side does not always keep up. So fluid leaks into surrounding tissue. What makes this one dangerous is not usually the swelling itself. It is what people do next. They get nervous. They look down and think, is my heart failing? Are my kidneys shutting down? And instead of calling Dr. Clara Hoffman or the clinician managing their medication, they start making quiet decisions on their own. They skip a dose before church. They skip a dose before a family gathering. They skip a dose on days when they know they will be walking more. That feels logical. But while they are feeling proud for reducing the swelling, blood pressure may be rising again in the background. That is the trap. Swelling does not always mean the medicine is damaging the heart. Sometimes it means the drug is doing exactly what this class of medication is known to do. The answer may be dose adjustment. It may be timing. It may be a regimen change. But the dangerous move is silence. If swelling is new, worsening, or paired with shortness of breath, chest discomfort, or sudden weight gain, that deserves attention. Now, side effect number 6. This is the one that makes seniors lose trust in their own balance. Side effect number 6 is dizziness and lightheadedness. Not always room-spinning vertigo. Often it is subtler than that. It is that floating feeling when you rise from bed. That brief need to hold the kitchen counter. That pause before taking the first few steps. That moment when the body does not feel fully under your control. Both amlodipine and losartan can contribute to this because both can lower blood pressure. And in an older adult, the issue is not just discomfort, it is mechanics. One unstable second can change a life. One missed grip on the bathroom sink, one foot that catches a rug, one fall, one fractured hip, one head injury. That is how a medication side effect becomes a major turning point. And this is why people miss it, because it does not happen every hour. It may happen after a hot shower, after a restless night, after skipping lunch, after sweating more than usual, after standing too fast. After a day when the body is slightly more dehydrated than normal. The same pill can feel different on a different day because your body is different on a different day. That is how side effects hide in seniors. Now, side effect number 5. This is the one family often notices before the patient does. Side effect number 5 is unusual fatigue, sleepiness, or heaviness in the body. Not normal tiredness after a busy afternoon. I mean that strange flattening of energy. That feeling that walking across the house takes more effort than it should. That sense that your body is slower, your motivation is lower, and your afternoons feel dimmer than they used to. Amlodipine can cause drowsiness and tiredness in some people. Losartan can also contribute to weakness or low energy feelings, especially if blood pressure is being pushed lower than the body tolerates well, or if hydration is off. This is one of the most dangerous symptoms to misread because it is so easy to blame on age. People say it is the weather, or sleep, or stress, or I'm just slowing down. But if fatigue appeared after starting the combination, after a dose increase, or after another medicine was added, that should not be dismissed casually. The body often whispers before it screams. And when seniors ignore that whisper, they begin compensating in ways that make everything worse. They walk less. They drink less. They cancel plans. They stay in a chair longer. On paper, blood pressure may look controlled. In real life, strength and confidence start slipping away, and treatment is not supposed to do that. The goal is not just a better number. The goal is a safer, more functional life. Now, side effect number 4. This is the one that frightens people because it feels as if the heart itself is objecting. Side effect number 4 is a pounding heartbeat, fluttering, palpitations, or an irregular feeling heartbeat. For some people, this is brief and harmless. For others, it is the first signal that something deeper needs attention. A senior lies down at night and suddenly becomes aware of every heartbeat. Not always pain, not always true arrhythmia, but a heartbeat that feels louder, harder, faster, or less steady than usual. That sensation creates immediate fear. Is it anxiety? Is it the medicine? Is it low blood pressure? Is it an electrolyte problem? Is this the beginning of something serious? Sometimes the sensation passes quickly. Sometimes it keeps coming back in the evening. Sometimes it shows up after dehydration, heat, or a change in routine. The point is not to panic. The point is to respect it. A brief palpitation is not automatically a catastrophe, but palpitations combined with dizziness, fainting, weakness, chest discomfort, or shortness of breath should never be minimized. Common medicine does not mean trivial risk. Now, side effect number 3. This is where things become more serious. Side effect number 3 is blood pressure dropping too low, near fainting, or actual fainting, not just mild dizziness. I mean that cold wave through the body when your vision dims, your knees feel weak, and you know you may go down if you do not sit immediately. This can happen with blood pressure medicine in general, but after 60, the combination deserves extra respect because 2 different medicines are lowering pressure at the same time. That is helpful when the body is stable. It can be dangerous when the body is not. This is how it often happens. A senior wakes up after poor sleep, or has a stomach bug, or eats very little, or spends too much time in the heat, or has diarrhea, or is simply not drinking enough. but the pills are still taken as if nothing changed. That is where trouble starts, because a body in July heat is not the same body. A body with vomiting or diarrhea is not the same body. A body that handled the medicine safely on Monday may not handle it the same way on Thursday. And older adults often fear high blood pressure so much that they forget low blood pressure can injure them too. A beautiful reading on a home monitor means very little if the person attached to that monitor feels faint, hollow, weak, or unsteady. Numbers matter, symptoms matter more. Now, side effect number 2. This is the problem many people never feel clearly until lab work reveals it. Side effect number 2 is kidney stress, worsening kidney function, or in some cases, acute kidney injury. This is where losartan deserves real respect. Losartan is not a bad drug. It is a powerful drug. And powerful drugs require context. The kidneys are extremely sensitive to blood flow, pressure, hydration, and medication interactions. If an older adult becomes dehydrated, takes regular anti-inflammatory pain medicines like ibuprofen or naproxen, or already has reduced kidney reserve, the margin for error gets thinner, and that is how the situation becomes dangerous. Not through recklessness, through ordinary life, a few days of poor appetite, a summer heat wave, a stomach illness, a decision to drink less water to avoid getting up at night, a common pain reliever for the knees or lower back. Then suddenly, the kidneys are being asked to work under stress while the medication continues doing exactly what it was designed to do. And the kidneys do not always complain loudly. There may be no dramatic pain, just more fatigue, less appetite, more weakness, more swelling, or blood work that looks worse than anyone expected. That is why seniors can do well on this combination for months and then become unstable quickly after a brief illness. The treatment did not necessarily become wrong. The body changed, and the plan needed to change with it. Now, side effect number 1. This is the quietest one on this list, and in some cases, the most dangerous. Side effect number 1 is potassium rising too high in the blood. Hyperkalemia. If that word sounds technical, here is why it matters. Potassium helps control the electrical rhythm of the heart. Losartan can raise potassium levels in some patients. Not everyone, not every time, but often enough that it deserves real attention, especially in older adults. And what makes this side effect so dangerous is how silent it can be. Swollen ankles get noticed, dizziness gets noticed, but high potassium can build with very little warning. Maybe the legs feel unusually heavy. Maybe there is weakness that feels oddly muscular. Maybe there are cramps. Maybe the heartbeat feels strange for a moment, or maybe there is no obvious sign at all until blood work catches it or the heart rhythm becomes unstable. This is also the side effect that careful people accidentally make worse. They are told to reduce sodium. Good advice. So they buy a salt substitute. They use electrolyte powders. They add meal replacement drinks. They choose heart-healthy products without realizing some of them contain potassium. And all the while, the body may already be under a medicine that can raise potassium. That is how a disciplined senior can walk directly into a problem while thinking they are doing everything right. Not careless, uninformed. And that is what makes this one so important. Because the heart does not run on good intentions. It runs on electrical balance. So if you remember only one thing from this video, remember this. The most dangerous side effects in seniors are often the ones first mistaken for ordinary aging. So what should you do if you are over 60 and taking amlodipine and losartan together? Do not stop the medication on your own. Do not ignore swelling, dizziness, fatigue, palpitations, faintness, dehydration, or sudden weakness. Do not assume a low blood pressure reading automatically means everything is fine. Do not casually use potassium salt substitutes, supplements, or frequent NSAID pain relievers without checking first. Do not treat illness as irrelevant. Vomiting, diarrhea, low appetite, fever, and heavy sweating can completely change how safely your body handles the same routine. Know your baseline. Notice when your shoes fit differently. Notice when standing becomes harder. Notice when your energy changes. Notice when your heart feels different. Get the blood work Dr. Clara Hoffman or your prescribing clinician recommends. Kidney function and potassium are not minor details. They are part of safe treatment. And if you care for a parent or spouse on this combination, pay attention to the quiet changes. Family members often notice slower walking, more fatigue, more swelling, or more confusion before the patient admits anything is wrong. Let me bring the 7 side effects together clearly. Number 7, swelling in the ankles, feet, or legs. Number 6, dizziness and lightheadedness, especially when standing. Number 5, unusual fatigue, sleepiness, or body heaviness. Number 4, pounding, fluttering, or irregular feeling heartbeats. Number 3, blood pressure dropping too low, near fainting, or fainting. Number 2, kidney stress, especially when dehydration or NSAID pain relievers enter the picture. And number 1, high potassium, the silent problem that can disturb the heart's rhythm before many people realize anything serious is happening. I want to end with one truth that is not explained nearly often enough. Blood pressure treatment is not just about lowering a number. It is about protecting a life without shrinking that life. If the reading looks better, but the person feels swollen, weak, frightened, unstable, dehydrated, or unaware of kidney and potassium risk, then the conversation is incomplete. And incomplete information is dangerous after 60. Because one fall matters more. One missed meal matters more. One stomach virus matters more. One over-the-counter pain reliever matters more. One healthy salt substitute matters more. So if you or someone you love is taking amlodipine and losartan together, do not panic. Do not self-diagnose. And do not throw the pills away in fear. That is not the lesson. The lesson is to stop taking the combination casually. Take it seriously. Understand it. Watch the body. Respect the warnings. Ask the right questions. That is how medication stays a tool instead of becoming a trap. And that is how you avoid saying, weeks from now, I thought it was just aging. Sometimes it is not aging. Sometimes it is the body asking for attention before the situation gets worse. Take care of yourself.